Okay, so some other important questions. A 16-year-old patient presents to clinic requesting birth control. So this is for birth control. 16-year-old patient. Okay, so it's an adolescent. With the diagnosis of health-seeking behaviors, the best goals have the patient. So what is the best goal for the from among the following options? Verbalizing understanding of safe sex practices and following safe sexual practices in all encounters. Not engaging in sexual encounters until she is over 18 years old and maintaining a healthy lifestyle. Recognizing the sign of pregnancy and the symptoms of sexually transmitted diseases. Understanding safe sexual practices and use a condom to prevent pregnancy and sexually transmitted diseases. So you can filter these options. You see, option A, verbalizing understanding of safe sex and following safe sexual practice in all. So this option, when you read itself, you can understand that this doesn't prevent pregnancy, isn't it? Because 16-year-old patient came to the clinic for birth control. So she needs birth control. So some birth control measures should be there. In this option, you don't have any birth control measure. Not engaging in sexual encounters until she's. So again, this you cannot be very sure because this is their personal discretion to have encounters or not, isn't it? So again, this also cannot be. Recognizing the sign of no, this cannot be at all. She came for birth control, so our ultimate motive is to advise about birth control practices, isn't it? Not to uh, um, help her recognize the sign of pregnancy. No. But this you see, since it is a birth control clinic, it's a birth control option, isn't it? So this is the most advisable birth control option for adolescents or for teenagers. So understanding safe sexual practices and use a condom to prevent pregnancy and STD. So this will be the apt one. So even though you don't have much knowledge, just by looking at the MCQs, it will be easy for you to or filter the answer. A nurse plans to teach a group of 20 to 25-year-old women about OCPs. The nurse should instruct that the OCPs may increase the risk of PIDs, cause acne to worsen, decrease the risk of breast and cervical cancer, decrease the risk of endometriosis. So this is very correct. So OCPs, this is one of the advantage of having OCP is that it decreases the risk of endometriosis, whereas it increases the risk of breast and pelvic cancer. It doesn't have any relation with pelvic inflammatory disease. OCPs has no relationship with pelvic inflammatory disease. It has no relationship with acne worsening, but it increases the risk of breast cancer, which is written as decrease. So you can eliminate this option. Decreases the risk of endometriosis. So OCP, one advantage of using any of the oral contraceptive pill is that it decreases the risk of endometriosis. It decreases the risk of endometriosis. Chalo. Following lumbar surgery, a patient has a 4 millimeter surgical incision. So patient has had a lumbar surgery and there is a surgical incision. The incision is a clean and the edges are incision is clean and the edges are well appropriate. This type of tissue healing is classified under which one? Is it primary, secondary, tertiary or superficial epidermal? So you have an incision and the incision is clean and the edges are appropriate. So it is primary. Okay, it is the primary tissue healing process. Shrinkage device is applied after surgery for amputation of leg. The goal of shrinkage device is to form residual limb to what shape? It is not from, okay, it is form, FOR. So this is the answer. So you should understand when the person is having amputation and that particular portion, the leftover limb should have a cylinder, should be like this, should be like the cylinder with the blunt end. So the residual limb should be cylinder with the, so that is the reason we put a shrinkage device. So shrinkage device is applied after surgery for amputation of limb. The goal of the shrinkage device is to form a residual limb into what shape? It is to form cylinder with blunt end. So that is how it should be. If it is not, there are chances of deformities. Okay. So it is always good for the extremities to have the shrinkage devices should be applied so that it will be a cylinder with blunt end. Okay. Next question. A nurse administered a dose of morphine sulfate as prescribed to a patient who is in for anesthetic care unit, that is PSU. A nurse administered a dose of morphine sulfate. So, a dose of morphine sulfate was prescribed to a patient who is in PSU. The patient appears to be resting comfortably and the respiratory rate is 8 and the oxygen saturation is 21 via nasal cannula. So this shows it is very critical, isn't it? What do you can understand? The way, because see, looking at this question, it is very well understood that the patient is in respiratory depression. The patient is in respiratory depression as the side effect of morphine sulfate. So respiratory depression is the most common side effect of morphine sulfate. So since the patient is having respiratory depression, it is very important to understand overdose of morphine sulfate has happened. So immediately we should try to reverse. And so the antidote is naloxone. Okay. So this is the antidote for morphine toxicity. So this is the antidote for morphine toxicity. So it is very important.